Good afternoon, everybody. Thank you for joining us today on our public update meeting. Today we've got Richard Flinton, who's the chair of the Local Resilience Forum and chief executive of North Yorkshire County Council, Mike Walker, who chairs the operational group around the response to COVID-19, Lisa Winwood, chief constable, and Andrew Brodie, chief fire officer. So Richard, I'm going to start with you, if that's okay, because I know you've another meeting to go to. So thank you. If you want to provide an update. Oh, have we lost him?
Yeah, no, sorry, I'm there. Just playing with the mute button, Julia. So the overall situation is mirroring in North Yorkshire very much what we're seeing nationally. So that is coming up on the downside of the curve is particularly evident when we look at hospital admissions. So we've had day-on-day lower hospital admissions in terms of COVID-19 related cases. Now that we can see there has been sufficient hospital.
Richard, can you just lean a little bit closer to the mic because we're struggling with the audio a little bit?
Okay, is that better?
Much better, thanks.
Okay, so hospital capacity throughout this period has been good. So both in terms of intensive care and general capacity, the North Yorkshire system has operated well within that. Capacity at the moment is around about 60% in both intensive care and overall capacity, overall hospital capacity. So that's good. In terms of deaths, we're in the region of, just excuse me for being slightly vague, Julia, but we're in the region of 155 North Yorkshire deaths reported in hospital settings. We have a worrying phenomenon that is replicated across the whole country in terms of deaths in care homes. And in North Yorkshire, we believe in terms of reported deaths, these are not necessarily deaths that have all been followed through with testing. We have in the region of 111 deaths in North Yorkshire reported from care homes. So care homes still represent a significant hotspot in the disease within a context of the downward cycle of the overall curve in the rest of North Yorkshire. But we're still in a serious situation, even though we've got that overall situation to report, Julia.
Okay, thank you. Can I just, so we've had a number of questions. I'll just ask the ones that are more sort of relevant to you, if that's all right now, as we work through it. So we've had a question around fly tipping and the closure stroke possible opening of the household waste recycling sites. I'm just wondering if you just might address that.
Certainly, yes. I mean, we've been asked around this in terms of some other members of the public ringing into us and some local councillors asking around it. So it is a topic of interest. I just want to remind everybody that the reason that we closed the HWRCs in the first place is a view that these were not essential trips in the large, as well as wanting to make sure that we could deal effectively with social distancing, etc., and hygiene procedures inside the sites. Government is very keen that we open HWRCs and have put out some new guidance saying that in circumstances of householders wanting to dispose of waste that is posing a risk in their homes, that a trip in those circumstances to a waste site is permissible. So on that basis, we are moving to open the household waste recycling centres, but in a phased basis. And part of that is because we expect some of them, even though people should only be going to them on a limited basis where waste is posing a risk, we still believe that there will be some quite considerable demand. So we're only opening those sites where we can cope with that demand in terms of impacting on the highway. So we're wanting to do this without calling upon police resources so that we can contain it within the council workforce. So we're opening 10 sites from tomorrow. And the details up very quickly. Those sites are West Harrogate, Leeming, Catterick, Skipton, Thorntondale, Sowerby, Seamer near Scarborough, Selby and Stokesley. And we will be learning the lessons of how those sites get on in terms of getting back up to operation, how we can put in place safe working practices in those sites, which are generally larger. We will be shutting every other bay so that we've got distance between cars and people working in them. And we will have extra staff managing the queues to make, and then to, when the queues get too long and we start infringing on the highway, to actually turn people away and to stop them joining a queue. So there is a very strong message from us, Julia, to go out to people that this is a phased opening. We will open others as soon as we can. Please only go to these sites if you absolutely need to, because waste is becoming a hazard in your household. When you go to the sites, we only want one person to come out of the car to deal with the waste. So don't get a car full of people who suddenly leap out. We want to make sure that these are controlled and safe. And just to remind everyone, the number one mission that we as a country are on at the moment is to stop the onward transmission of the virus. So please deal with this issue in that spirit. And on the point around fly tipping, Julia, some people have been saying that one of the reasons we should get the waste centres up and running is because there's an issue of fly tipping. And undoubtedly there will have been some incidents of fly tipping around the county. Our local intelligence is that that is not significantly worse than would ordinarily happen. So we don't believe that's been a problem, but nevertheless, there is absolutely no excuse for anybody fly tipping under any circumstances. And if people can store waste at their own homes, they should do that. And if they can avoid undertaking projects that generate waste, then they should also do that as well, because this is at the moment when we're trying to reduce travel around the county. Okay, thanks, Julia.
That's really, really helpful. So what we don't want is just everybody piling out of their houses and turning up at those sites tomorrow. That would not be helpful at all.
That's right. Yeah, absolutely right.
Okay. All right. And you know, if people want these facilities open, then we've got to sort of use them responsibly, I think is the message as well. So there's just one other question, Richard, I think for you, and that is, we've had a question around in terms of the fixed penalty notices that the police are issuing, where the money from the fines goes. Now, the money actually goes to the Tier 1 local authorities, so to the county council and to the City of York. It does not come to the police. And the second part of that question is what it is being spent on. Of course, we don't know how much it will be yet, but I suspect it is not a large amount of money in the grand scheme of things.
Yeah, that's right. And maybe it's be helpful if I talk about the grand scheme of things, which we are estimating is an impact to the county council's budget in the region of £65 million. And that's made up of the actual cost of being able to combat the crisis, but also issues around lost income that will be coming into the council in the future as well. So in terms of fines, Julia, we haven't earmarked them for any particular area. And what they will be used for is to go into general funds to try and make a small contribution to offsetting the huge costs the council has incurred in fighting the coronavirus.
Thanks. I mean, I think the subtext there is that there is obviously no sort of financial incentive for the police to issue fines, and that it is absolutely around stopping the spread of the virus, and that's what this is all about.
Absolutely right, Julia. And frankly, from a local authority point of view, can I just say that we are really grateful for the approach that the police have taken, which we believe is absolutely proportionate and has helped make communities of North Yorkshire safer as a result of that type of enforcement action. So, no, the funding is not a reason behind that, and in truth, it's going to be very, very small.
Okay, thank you. Does anybody else on the call have any questions for Richard before he dials out? No? Okay. So, Richard, thank you very much indeed for joining this. It's hugely appreciated. Thank you again.
Okay, pleasure. Thanks, Julia. Bye-bye.
Bye. Okay. So, Mike, if I could come to you now as the chair of the Strategic Coordination Group to just follow on from anything there, and then I'll come to Lisa to talk about organised crime, if that's all right.
Absolutely, yes, thank you. Yeah, just to build on what Richard Flinton was discussing there, my role is as chair of the Strategic Coordination Group, so as one of the Category 1 responders to this major incident, and my role is of chair of that group. And just to confirm that the 5 key strategic risks that we're currently focusing upon across North Yorkshire and the City of York is the NHS demand management, and Richard's touched upon critical care bed capacity and normal bed capacity. But what we're also focusing on now, as the NHS move into the second phase of the COVID response, which includes bringing more people back into hospital for elective treatment in the likes, so areas such as high risk cancer care, and what the knock-on effect will then be on health and social care amongst other partners. So that's one of the key risks that we're currently working with the NHS to try and support them on. Also, the care setting and upholding the Care Act is another key strategic risk that we focus upon, and an incredible amount of work ongoing to ensure that the 268 or so care homes that we have in North Yorkshire and the City of York are looking after their residents as we would expect them to. And also, one of the key pieces of work within care homes currently is how we, as a local resilience forum, ensure that we get the testing right within care homes for those people who are symptomatic but also not symptomatic, so that we ensure all staff and residents of care homes are tested for COVID-19. So that's a key piece of work currently ongoing as we speak. One of the other key strategic risks is personal protective equipment across all agencies. We have regular drops of PPE. So, for example, today, 7 pallets worth of personal protective equipment has come into our local resilience forum from the Ministry of Housing, Communities and Local Government that we will distribute across all partners to ensure they've got correct PPE. And the fourth risk we're looking at is the testing of key workers across North Yorkshire and the City of York. So there were several phases of testing that we have. First phase is a regional testing centre, which is at the north of York at Poppleton Bar Park and Ride. That testing centre has so far tested 4,582 people. We also have access to satellite testing sites in the West Yorkshire area and also in the Cleveland area, where the key workers from North Yorkshire and the City of York can also utilise. One of the key pieces of work that's been ongoing over the last week and 10 days, as you will have seen nationally, is trying to meet the 100,000 tests per day. So we've had mobile testing units set up within North Yorkshire, and as you know, with the size and the geography of North Yorkshire, we've had numerous testing stations set up between Settle and all the way across to Whitby and in between, and those testing units have tested 4,123 people so far, and the Local Resilience Forum is helping with the military and with partners to set those testing stations up to ensure that we get the right coverage across North Yorkshire and the City of York as well. And then there's the home testing kits, which there is much more capacity in that national system now. So anyone who needs and qualifies for a home testing kit at home should be able to get one. We're awaiting some further information this week on contact tracing. As we know, the Isle of Wight are conducting a test this week in terms of contact tracing, and we expect as a Local Resilience Forum to gain more information of how that will look moving forward into the next week. So an incredible amount of work ongoing within the local resilience forum, with the key aim of supporting our health colleagues to ensure that we reduce the spread of the virus. And as Richard has mentioned, we are in a plateau in terms of the number of cases across North Yorkshire and the city of York. But with the increase in testing, we do expect the number of cases to increase on a higher trajectory. But that's not against what we would expect with the increase in testing.
Okay, so that's really helpful, Mike. Has anybody got any questions of Mike in respect of any of those? No. Okay. Mike, will you just cover off the status with the sort of fixed penalty tickets and police operations around COVID?
Of course, yes. So we continue in North Yorkshire to adopt the 4E strategy, which is to engage with people, to explain what the restrictions and the regulations are, and to encourage them to return home if they're out of the house for a reason that's not covered in one of the reasonable excuses. But unfortunately, on a number of occasions of the last few weeks, we've had to conduct enforcement activity. We have issued over 500 fixed penalty notices now across North Yorkshire and the county. We're one of the top 6 forces nationally in terms of the number of tickets we've issued, and certainly over the last 2 weeks we were 3rd highest in the country for the number of tickets. We don't want to be the 3rd highest in the country for the number of tickets. We want people to stay at home, we want people to protect the NHS, and we want people to save lives. But unfortunately in North Yorkshire we are bordered by 7 different counties. We know North Yorkshire is a beautiful place with the Dales, the Moors, with a lot of beauty spots in the coastal areas, and people do normally travel out to those areas. And unfortunately, we've seen a small pocket of people who believe that the restrictions are not for following and have not done so. Therefore, we have increased patrols over the last few weeks. We've engaged with an awful lot of individuals, and unfortunately we have had to issue tickets on numerous occasions. Some of the examples of people travelling some considerable distances from around the country to come to these beauty spots is unacceptable. We have had to deal with it in the way we've dealt with it. We're working with regional forces to ensure that we protect each other's borders in terms of people coming over when they shouldn't be, to ensure that people do stay at home. We've done an awful lot of communication within North Yorkshire, but out regionally and nationally as well, around the problems we've faced, to try and just get that message out that North Yorkshire, it normally is open for business in terms of people coming into North Yorkshire and enjoying what North Yorkshire has. But with the restrictions that we currently have, we do not want people travelling in when it's not for an essential journey. We don't want people gathering. We don't want people mixing households and potentially spreading the virus. So we've had to tackle those particular issues, and we will continue to tackle those particular issues until restrictions are lifted, because we must do what we can to help prevent the spread of the virus.
So I'm just going to pick up on we've had quite a lot of questions, so we will get back to people individually, but we've themed them. And one of the themes, Mike, is around this whole question of travel to exercise, and is it, what isn't allowed, and the sort of some of the confusion around that. So some people sort of quite naturally thinking, well, national parks are big open spaces, there isn't any chance of spreading the virus, and some people getting very concerned about that type of activity because they think it will spread the virus. So it would just be helpful to have a clear message around that. Yeah,
so in terms of national parks, we have found people are travelling large distances from outside North Yorkshire to visit areas to exercise. Now, this is not acceptable. Early in the lockdown, we did find car parks in the national parks full of cars, and then country lanes around those car parks also full, which puts people at risk. So if everyone has the same idea to go to a same particular location and go for a walk to exercise, that causes issues with the transmission of the virus. You've also got issues with partners such as the National Park Rangers and Mountain Rescue, concerns over people getting lost, people getting injured in remote locations. That causes pressure on Mountain Rescue and Rangers as well. And also the rural communities who are in those areas told to stay indoors. They did see initially large volumes of traffic and then lots of people parked up and going for walks when, they're thinking, well, everyone else is having to remain indoors. We particularly had issues at Sheepwash near Osmudley over the weekend with a number of tickets issued for people parking all over the road because they couldn't get into the car park. So those sort of issues are continuing. The very fact is that you're allowed one type of exercise, to leave the house once a day to conduct some form of exercise. And the time away from your house must be minimised, must be as little as possible. There is a reasonable excuse, and there was some guidance that came out a few weeks ago, which said that you're allowed to drive to exercise. However, the considerable distances and time that people are spent driving to get to our beauty spots to go for a walk is not acceptable, which is why we've had to engage and explain and encourage, but also conduct enforcement activity around that. So the national parks may be a big open space, but the message is clear from the government, and that's the message that North Yorkshire Police and the are sticking to in terms of how we're policing it, is you need to stay at home. You should only leave the house to go to essential shopping such as food and medication, to exercise once a day, either on your own or with members of your family, to help somebody who's vulnerable or to escape danger, and also to travel to and from work if you cannot do that work from home. That has not changed over the last few weeks. What has changed is people's perception and their tolerance to those restrictions. And we've found that more people have decided to try to leave home, not stay at home, so not follow the government's guidance, and go to these areas, so national parks, beauty spots, but even the urban locations. So I know there's questions around, we're talking a lot communications wise and media wise about these beauty spots, but believe me, we are doing a lot of activity in the urban locations as well. There is a perception of high footfall of pedestrians and traffic when that has occurred. So it occurred in Harrogate about 3 weeks ago. We had to introduce a mobile engagement point, which is where we ask drivers to stop and we ask them the nature of their journey. And we found that 99% of people were out for a legitimate reason. But there has been more traffic on the road. We've seen that nationally over the last couple of weeks, and we will respond to that accordingly until those restrictions change and are lifted.
Okay, thanks, Mike. So just a good example then is I understand that officers, we've had a lot of issues at Malham, and officers have been actually, turning people away before they've even got there. So, early doors. So that type of people that have to expect that type of activity. Yes.
So we've had people travelling very early in the morning, half an hour, 2 hours in the car to then go walking for several hours. Now, that's something that sometimes people will normally do, but we are not living in a state of normality. And I'll go back to the government's message. Stay at home unless you have to leave the house for those reasons that I've described. So driving for an hour to go walking for 3 hours up at Malham Cove, I can tell you now, is not acceptable. And we will turn you around and ask you to go home and stay at home. There are various different ways to exercise at home or very close to your home address. We understand if you live in a real built-up area and you have to drive 5 minutes to somewhere else so that you aren't coming across people. That's obviously more acceptable than driving from one county to another for half an hour to an hour to then go walking for several hours, because it's not minimising the time that you spend away from your home address, because the government want us to stay at home. So that's what we're trying to tackle. We want people to obviously, it's the same in terms of cycling. There's nothing stopping people cycling. However, cycling for several hours is not minimising the time you're away from home. There are other means. If people have turbo trainers at home that they would do in winter, if they'd cycle in winter, we ask people to jump on the turbo trainers. It's not forever. We don't, hopefully the restrictions will be lifted and people can then get out and about. But it's about minimising the time that you're away from home exercising, or trying to exercise from home, and changing the means in which way you exercise, and doing something differently as opposed to what you normally would do at this time of year. It's unfortunate, but we have these restrictions in place.
Thanks, Mike. Will, did you want to ask a question?
I just wanted to come in, really, a piece of information. I know generally lots of these questions are people trying to find a way to go and exercise somewhere, or go walking, etc. But I just thought I'd put the other side of the story, which is 60 odd letters of thanks to North Yorkshire Police for the various actions you've taken, some of which is around keeping some of those more rural places safe, etc. But I just thought I'd say there's been a lot of thanks coming your way as well.
And we do appreciate that, and the vast majority of the members of the public that we do encounter do understand, once we've explained to them why their journey is probably non-essential, and they do go home, and it's part of that education process. And this is why we'll continue to do communications to people, to let people know what is acceptable and isn't acceptable. But the firm message is stay at home unless you have to leave the house for one of those essential reasons.
And I think that probably applies to some of the sort of non-essential shopping. So we've had a question about B&Q, and those types of shops that are starting to open. Is probably the same message, I would imagine.
So there's a couple of questions there. One around the florists. Florists are allowed to open. They're not one of the premises that was required to close. If people are unsure about the premises that were required to close, there's an incredible amount of information on the .gov.uk website in terms of those premises that are allowed to still operate, but with social distancing measures in place. B&Q is one of those, and other hardware stores are one of those companies that is allowed to open. But for essential supplies, to go and get things that are nice to have would be considered likely a non-essential journey. But what I would say is, as the police, we are not policing what people are buying in any of the shops, and I'll be firm on that. That is not our role. But what we ask the public is, don't leave the house unless for an essential reason. If your fence has blown down and you need to get a new fence panel, that'd be a good reason to go to B&Q. But we've got people suggesting people are buying hot tubs and various different aspects in there. But we cannot police what those stores allow people to purchase. That's not our job. Okay,
fantastic. Thanks. So the only other question that we haven't covered, I think, is road safety and some of the issues with cyclists. I know we've seen an increase, Mike, in cycling accidents.
Yes, we have, and we noticed this quite quickly. We know there has been more cyclists out on the road. It is a form of exercise people can do, but we noticed early some in terms of novice cyclists who were going out without relevant protective equipment, and were getting themselves into collisions. We have done a lot of media messages around road safety over the last few weeks, which focus on ensuring your bike is mechanically sound to go out and about, and ensuring you're wearing a helmet. I've seen many people riding on main roads without helmets on, and there's no legal requirement to wear that helmet. But in terms of protecting your head, people should be wearing helmets, because if they're falling off and then going into hospital, that's causing the strain on the NHS. And we'll continue to do those communications out with people to ensure that they are wearing the relevant kit and they're on an appropriate bike and they keep safe. We've had issues of people not giving the 1.5 metre distance, so we've tried to target motorists in terms of communications around that and ensuring that we're monitoring the roads ourselves when people are passing cyclists. So there's various different things we've done to ensure that we get some messages around making sure that if people are choosing to cycle as their exercise, that they're doing it safely.
Okay, and I suppose presumably if you're seeing any issues with the way that drivers are behaving or those types of things, you will deal with them in order to keep cyclists and other vulnerable road users safe.
We are. I mean, I pulled over a driver about 2 weeks ago who didn't give the cyclist. I was behind him, didn't give the cyclist enough room, and pulled over and gave words of advice. Wasn't aware that needed to give 1.5 metre distance. So had a chat with that, and that's happening all over the county to ensure that we keep everybody safe that's on our roads, which we will continue to do. And
I will just make a plea for horse riders. It's 2 metres. You've got to keep away from a horse. So when you're on the roads as well. Okay, so that sounds great. Has anybody else got any other questions? No. Mike, thank you very much indeed. That's been extremely comprehensive, appreciated. Lisa, can I turn to you now to talk about organised crime?
Absolutely, yes. So understandably, the main focus of people's daily life has been on the protecting people from the spread of the virus. But of course, in the background to all of that, normal policing continues. So I'm really pleased to say that we have excellent capacity here in North Yorkshire Police. Our absence rates are extremely low, and we have many people out on patrol, as Mike has said, trying to keep our members of the public safe. But our police officers are also continuing to tackle criminality and protect our communities. So we've seen some excellent police work in terms of tackling some of those criminals who are using our roads to move around. We've had some good arrests of people for drug-related offences. So we've actually had 132 arrests in respect of drug offences since the lockdown on the 23rd of March. We've stopped and searched over 500 people. 80% of those linked to drug crime. And of course, because there are fewer people out and about, fortunately, around our county, those people who are moving around to commit crime are much more visible. So my plea would be to the community, please keep reporting those suspicious activities to the police. We want to know if people are acting suspiciously, if you're concerned. We want to ensure that people are protected from crime in their communities, and particularly those people involved in drug-related crime who are vulnerable often. And we want to make sure that we are tackling those people who continue to deal those dangerous drugs out in our streets and to people within our communities. So it's just to advise people, we are still out there tackling criminality, and our resources are at a high level, and we are stopping people moving around who are undertaking some of that criminal activity.
So, Lisa, we have had quite a lot of sort of comments around people worried about drug dealing and seeing drug dealing, and I suppose it comes into sharper focus because obviously, you know, we're supposed to be social distancing as well, so that you know, people feeling uncomfortable about that sort of thing, and presumably intelligence-wise should call it in on 101.
Absolutely, yes. So if you see something that you think is putting somebody's life immediately at threat, or you think that somebody is in the commission of a crime that's immediate and causing danger, so the sorts of circumstances where you would report a 999 incident because of a threat to life, please still ring 999 if there is a threat to somebody's life. Of course, that more general intelligence about people's movements, behaviour, the toings and froings from an address that should be more obvious to people, given there are fewer people moving around. And please call us on 101. You can also report through Crime Stoppers anonymously. We're happy to receive that information and act on it and gather that information so that we can tackle those that are involved in this level of criminality.
Thanks, Willa. You've got a question.
Yeah, well, the first is a statement, really, which is just on that point that we saw a report from members of the public a few days ago that led to some really significant arrests. So it really is worth it. You know, so if you see anything suspicious, do report it in. The other question, Lisa, was you mentioned resources being at a good level. I presume, does that mean investigations are carrying on as normal, as well as the more sort of visible bits of policing?
Absolutely, yes. So we will continue to investigate reports that are made to us. And of course, there's a lot of guidance been issued around social distancing and keeping people safe from an investigative perspective. So there's lots of guidance out there about our officers calling at people's home addresses, about arresting people and prioritising the necessity of those arrests, about custody procedures to make sure that we keep people safe. Because, of course, we don't want to cause more danger to people in terms of the spread of the virus. So we are adopting an approach that keeps people safe, that looks at that protective equipment that might be needed by our officers and staff if they do need to approach people, so that we also keep those people safe we're in contact with. We have clear custody procedures. We ensure that those people can still have all of the rights afforded to them in terms of legal advice, appropriate adults. All of those measures are in place so that we as the police can continue to tackle criminality and protect our communities.
Thanks. Has anybody got anything else? Because I'd quite like to move on to Andrew now, if that's okay. Yeah, Lisa, thank you very much. That's really, really helpful. Good to see that you are making some good arrests. That's really good to see. Thank you very much. Andrew, would you? Thanks, Lisa. Andrew, would you like to make your contribution?
Happily, Julia. Yes. In terms of the types of incidents that we're responding to, I'll go straight in with that. Really, there's been a significant change as a result of the restrictions that have been placed on people in COVID and the type of activities that people are undertaking. So overall, interestingly, our response is down by about 25% compared to the same period last year, and that includes quite large reductions in automatic fire alarms, and that's because factories and other businesses are closed down, so they're not causing those automatic alarms that we respond to, and an enormous reduction in the number of road traffic collisions because there's so much less traffic on the road. So a huge change. The same period last year we had 50 road traffic collisions that we responded to. This year there's only been 4, which I think is testament to people largely observing the rules around lockdown and not making unnecessary journeys, which is great news. But where we are seeing a difference is the number of small fires in people's gardens and outdoor spaces, and also a rise in what we call false alarm good intent, which is when somebody puts a 999 call in, believing that there's emergency, but when we get there, there isn't. It's simply somebody having a fire in their garden. So we would just repeat the message that Richard Flinton shared earlier on, the Chief Executive of the County Council, which is to avoid burning rubbish. Definitely don't fly tip any rubbish. And if you absolutely must have a bonfire, then to put in sensible, careful precautions, like only having small amounts on it, discussing with your neighbours so you're not being a nuisance, having some sort of a water supply available, definitely not putting on anything that would be explosive or anything like that, and just being really careful and sensible. We had one incident since we last spoke in a public update as an example, whereby somebody was burning off weeds in their garden. It set fire to a tree, which set fire to the shed, which set fire to the garage. Both of those were destroyed, and it even spread into that person's house, causing 50% of the roof to be lost. And on top of all that, the occupant had burns to their hands and had to be treated, which of course is also placing a demand on our NHS during their crisis. So overall, in terms of incidents, there's been an overall reduction, but we would ask people to be very careful when they're at home to avoid any unnecessary demand upon the fire service and to avoid themselves being injured or losing property. Another piece of good news for us is our availability of our fire engines. So that's gone up compared to the same period last year by 12.5% to over 95%. Now that is because our on-call fire crews are at home self-isolating and they are not going to work or they're working from home. That makes them more available to be able to crew their on-call fire engines. So that's really good news, but it's short term while the lockdown is in place, and we are considering the longer term impact on the economy and on jobs as to what that might mean for the availability of those on-call fire crews and fire engines. In terms of staff absence, it's hardly changed at all now. Compared to the same period, it's only up 0.7%. And actually, when you look at the the record over the last 5 weeks, there was a slight peak where it increased from 3 to 5%. But now at the end of this period, or towards the end of this particular time, the levels are almost identical to that they were last year. So that's helpful. So in terms of the types of other work that we're doing, we continue to do our normal work around prevention, protection and community resilience, as well as the response, albeit we're continue to adapt the way that we do that so that we're not unnecessarily coming into contact with members of the public, or indeed them coming into contact with us and us risking them. But there is now still in place our tripartite agreement between the Fire Brigades Union, the National Fire Chiefs Council and the National Employers, which sets out a number of activities over and above those that a firefighter would normally undertake. And we have adopted many of them, and we have plans in place to adopt any of those 8 other activities should we be asked to do so. But we're making phone calls to members of the public to provide welfare calls and assurance and to check their safety from fire. We're providing deliveries to the NHS and also to householders in terms of food and pharmacies. And we've been out leafleting just to provide people safely with additional information to keep themselves safe while they're self-isolating at home. And as we know, most accidents happen in the home. So we're just doing everything that we can to reassure people and to educate them as to how they can keep themselves safe. So in terms of our update, I'll stop there. I'll pause there for any questions that you might have, Julia. And I know we have a hot topic to discuss later on.
Thank you, Andrew. I suppose it's good to see from one perspective the household waste recycling sites opening, because that might mean that people have fewer bonfires. So that's probably quite a good thing, even if fly tipping is not thought to be such of an issue in North Yorkshire. Will, do you have any questions? I'm happy to move into the your topic, which is around how you're supporting vulnerable people. Yep. Okay.
Should we move into that?
Yeah, that'd be great. Thank you.
Okay, I'll just scroll my notes from here. So the way that we are helping the vulnerable is through the local authorities, through the Local Resilience Forum and through the Strategic Coordination Group. So we've now got in place an agreement with North Yorkshire County Council to share data about the shielded people, those people who are having to stay at home for longer. There are 16,000 of those on the list at the moment in North Yorkshire and York, and about 8,000 of them have been contacted. So what we are now doing is we are recontacting that first 8,000 to check on their welfare, and we're adding into that advice about fire safety and keeping yourself safe. And that next 8,000, which the local authority continue to contact, they're now adding into that 8,000 information about fire safety and keeping yourself safe while you're at home. On top of that, we have local agreements between fire crews and pharmacies and food banks for fire crews to be out and able to deliver on their behalf. So that is underway in many local areas in both York and North Yorkshire. And we continue to offer our capacity up to the local authorities and any other organisation that might be able to use us. What's really important to recognise is that there's a huge army of volunteers who have put themselves forward, and the local authorities are clearly using them, employing them to deliver some of the tasks that the fire service might be able to if it was necessary. But we don't want to burden local authorities unnecessarily with offers of help, but they know that we are here. And what we all anticipate is that as time wears on, as the lockdown restrictions begin to be lifted, some of those volunteers will return to work, and some of those volunteers will become fatigued with volunteering. They're being well employed at the moment in the main. And what we recognise is in the longer term, the months ahead of this COVID crisis, that's when the fire service might well be able to step in and fill that void as the volunteers begin to drop off. So we are absolutely committed to supporting our partner organisations and everybody in our communities. We're doing what we're asked to do, and we are able to do more if that time comes. And I'll pause there, Julia, and again, take any questions that you might have.
So, I mean, my main question, I think that's fairly clear, Andrew, but my main question is how crews are feeling about doing this type of work, because obviously it is a bit different from what they do normally. So, yeah, I'd be interested to hear about that.
Yeah, the crews that I've spoken to are well up for this. In fact, they are initiating a lot of this work themselves. So rather than wait until work to be tasked to them, local crews are taking the initiative and taking it upon themselves to contact pharmacies, to contact food banks, and to contact their local area partners and find out how they can be part of this. We're of course doing it safely, so we have risk assessments in place for all of these activities to protect ourselves and to protect the members of the public that we are engaging with. But our purpose as an organisation is to help people to feel safe and to be safe, and that isn't only safe from fire and rescue, that's safe in terms of their mental well-being, their physical health. All of that we are interested in and wanting to support much more broadly than just the fire and rescue service. And I think it's testament to those firefighters and those fire crews that they are pulling out all the stops, they're being creative, and they're finding new ways to do things. There's a brilliant example over at Scarborough, whereby Green Watch at Scarborough, and it's spreading to the other watches, are now delivering school classes for children who are away from school and being homeschooled to help those parents to give them and their children activities to do. And they're using fire service work as the means of delivering that. So the science and the mathematics and the language around firefighting and rescuing is being live streamed using Zoom by those firefighters directly into people's homes, so that those young people are getting those lessons direct from their firefighters, which is great. And the other thing that they're now doing is our fire cadet program, which was temporarily suspended because of the social rules around keeping apart. We didn't want young fire cadets coming into fire stations to get the normal input. That's now being sent to them via Zoom, and they're engaging really well with that, with firefighters in the fire station delivering the normal things, but using technology rather than all being in the same space. So it's been a huge ambition of mine, and it's set out in my Ambition 2025, that we do become more creative, we find new ways to deliver new services, and the COVID crisis has some silver linings insofar as it's given a really good impetus for those firefighters to take on board those ideas and our new ways of working and made that real. We've turbocharged that to a certain extent, and it's been really effective. It's been really helpful in that regard, albeit we would prefer that we weren't in that crisis. And another thing that we've done in the last month, and quite extraordinary, that the ICT team and the others who've been involved, is we've now installed video conferencing facilities in every one of our fire stations. So we will now be able to communicate with our firefighters, but also other agencies will be able to access that to communicate with their staff, and we will be able to use that as individual crews to communicate with our communities using technology rather than face-to-face, so we can reach more people in a shorter time. So there have been some real difficulties, some real challenges, of course, presented by the crisis. It's having a desperately sad and dramatic effect on some people's lives, both their well-being mentally through loneliness and their well-being physically through being ill. However, we have embraced the opportunities that it's presented as well, and we're doing all that we can to do the best that we can for the communities and our partners.
Okay, so that is really helpful to finish on some sort of slightly positive notes there. I would just like to also say thank you to all of the senior leaders, but also to the crews and to the frontline officers who are doing such amazing work. You know, potentially putting themselves at risk as key workers. You know, a huge thank you from us for doing that. You're really making a difference. So thank you very much indeed. And unless anybody else has got any more questions, which I can't see, I will draw it to a close. So thank you, everybody. Thank you.
Thank you.
Thank you.
Bye-bye.